Hello ladies and gentlemen, welcome to another Step to CK video. Today we're going to talk about the strategies of preparation for the USMLE Step to CK. USMLE Step to CK is definitely a harsh and rigorous 9-hour examination created to detect the ability of a physician to apply his clinical knowledge in a stepwise manner for the diagnostic and therapeutic management of a patient, requiring each applicant to think both fast and effectively. Most questions in Step 2 CK are straightforward, and you need to know how to interpret information on a clinical basis. It differs from Step 1 in that it asks you to assess the severity of a patient and pick the best next step. And you need to know that sometimes therapeutic measures take precedence instead of directly proceeding to diagnostic endeavors. However, you will still encounter weird questions where specific knowledge is required to answer correctly. Also, you must study interpretation of literature in biostatistics because you will encounter 4 to 5 of those questions as well. There are actually 4 types of questions in Step 2 CK. First, what is the best next step in management? 2. What is the diagnosis? 3. What is the best test to diagnose a disease in a specific clinical scenario? And 4. Pathophysiology and pharmacology questions like those we encounter in Step 1 examination. Now I would like to take a moment to emphasize why Step 2 CK is important and to whom it's important. First of all, it shows clinical knowledge and the capability to use your medical competency to prioritize things and follow specific algorithms in both diagnosis and treatment of clinical scenarios. Furthermore, for those who didn't do well in Step 1, Step 2 CK is a second chance to show their test-taking abilities and emphasize on a better clinical knowledge compared to basic sciences, which are tested in Step 1. Last but not least, specialties like surgery or emergency medicine give value to a good Step 2 CK score because you always need to know what the best next step is in a rigorous clinical setting. Now, regarding the preparation and techniques, there are a lot of guys out there that they give emphasis on their scores and month of preparation, and they try to correlate these two parameters. My advice to you is to not focus on the scores and months of preparation solely, but rather to focus on good techniques. Most importantly, after a lot of revisions, you will have to be able to know what to expect and to what physical exams to give value. You will need to know how to interpret the physical examination, the laboratory values, the history of the patient, and you will also need to remember correctly, fast, and effectively the required algorithms when applicable to solve the questions. Each question stem is a problem, and therefore you need to read actively through each and every single line and to interpret data to solve the problem. I also recommend creating algorithms and diagrams and also writing down the algorithms that you encounter that you banks right in your world. Therefore, you will be better prepared. Thank you for watching this video. If you like it, share it on social media, and write me down in the comments what you would like to see in my next video. Thank you. Goodbye.